A homeless man who was intoxicated arrived at a hospital after receiving a bath and food, suffered a cardiorespiratory arrest, and unfortunately died. What happened? I was on duty at the emergency room when a patient arrived, a homeless man, intoxicated but lucid and oriented. He was given some glucose, stayed on the stretcher for a few hours, and a nurse colleague asked him, "Don't you want to take a bath? We have clean clothes and I can give them to you. You'll leave clean and with new clothes." The patient said, "That's fine." He spent over an hour in the shower, came out clean and with clean clothes. My colleague got him some food. When he left the infirmary to go home, he had a cardiac arrest and didn't come back. The fact that the person is intoxicated means some sensitivities will be reduced. What I think happened to that person, unfortunately, is that maybe that person was feeling some discomfort. However, due to the alcoholic state, he didn't feel, let's say, chest pain. Food, digestive system, a large part of the blood in our body when we have a meal is directed to the portal system, the hepatic system, to be absorbed in the villi of the digestive intestine, large cattle. It was this food that, by reducing the systemic flow, caused the patient's cardiac arrest. Another thing, a hot bath promotes vasodilation. With that, we will have more blood in the venous and capillary parts, right? In other words, there ends up being a reduction in blood flow for cerebral perfusion. Could there be a connection? I don't know. A heart attack is when there's a thrombus, something that blocks the coronary artery. Could it be that he already had something in the coronary artery? And due to this reduction in blood flow, this partial obstruction, the blood flow in one of those coronary arteries was drastically reduced. And that region there suffered a sudden illness. If it's hypovolemia, the fact that he arrived intoxicated, even if he was lucid, who can guarantee that he wasn't dehydrated with low blood volume? He showered, which dilated his blood vessels, then ate, diverting blood to his digestive system. You understand that, in my mind, it still makes more sense that his cardiac arrest had nothing to do with a heart attack. And more likely related to maybe a reduction in volume in the central part. In my mind, it's still a cerebral hypoperfusion that led to cardiac arrest. What's your opinion?